Our next section is percutaneous umbilical blood sampling, often known as PUBS. This is transabdominal needle aspiration of fetal umbilical cord blood. In some areas, this is called cordocentesis, aspiration of the umbilical cord. This is a transabdominal procedure performed after 20 weeks under ultrasound guidance, typically with local anesthesia. This is a more time duration and takes longer than the amniocentesis. And the reason is because we're going to have to get blood from the fetal umbilical vein, and to maneuver the needle in is going to take much more precision than with putting the needle into the amniotic sac. The percutaneous umbilical blood sample can be either diagnostic, if you want to assess for fetal blood gases. You can also do a karyotype on the fetal cells. You can look for IgG, IgM antibodies if you're looking for evidence of an intrauterine infection, as well as therapeutic if you have fetal anemia because of Rh isoimmunization or because of parvovirus B19 or whatever reason, and you want to do an intrauterine transfusion, you would do this by using the percutaneous umbilical blood sampling technique. This has a higher rate of pregnancy loss, and you can see here, this is 1 to 2%. You better make sure that the likelihood of the benefit exceeds the pregnancy loss rate of 1 to 2%. The reason we don't do it before 20 weeks is because the umbilical cord vein is so small that technically it's going to be difficult to get a needle in without causing fetal death. One can use a color flow Doppler to identify where the fetal vessels are, and here you can see the color flow, which is shown up very nicely. This is an ultrasound image of the umbilical cord in cross-section. This is the umbilical vein. Here are the umbilical arteries, and you want to take the largest vessel. This is my cartoon showing the umbilical cord, and which vessel are we going to go into? We're going to go into the largest one, which is the umbilical vein. Pregnancy loss rate, 1 to 2%. And here you can see the color flow Doppler as well. Very helpful for identifying the vessels. And that is the end of percutaneous umbilical blood sampling.